COVID-19 is Dr. Georgine Nanos, CEO of Kind Health Group in Encinitas. Good morning, Dr. Nanos. Thank you so much for being here.
Good morning. Thanks for having me.
I realize it's a bit busy time. Want to get to a few of the common myths to dispel before we get into some of these questions. And it's hard to believe that this is even out there, but you've talked about hearing so many and seeing so much misinformation of people thinking that drinking bleach, vinegar, saline, alkaline water, or enough alcohol is going to cure you of this virus.
Right. That's absolutely not true. And drinking bleach will probably kill you. So
Right.
I strongly advise against that. So the best defense we have is washing our hands, social distancing, using hand sanitizer, not touching our face. And then if you're feeling ill, to just stay home.
As the tests become more available, we expect the number to rise much higher as far as those people who are testing positive for coronavirus, will we not? I mean, that's just going to be the sheer logic of it all.
Yes, definitely. We still, in the medical community, don't have the widespread testing that we're hoping for, but the hope is in the weeks to come, they'll be more available. But right now, we just have a very limited supply. So even if you're feeling mild symptoms, don't expect that you're going to get tested right now. Those tests are really still reserved for people who are have the potential to be critically ill and are going to require hospitalization or are in the emergency room. So we are reserving those tests for them.
Yeah, I mean, I was drawing the difference between having someone like Idris Elba come forward and say, hey, I was just with somebody who's now confirmed positive, even though he was showing no symptoms, he was able to get tested. And that's just not the case for our community, unfortunately, right now.
Right. And there are a lot of people out there, especially younger people, who are less likely to get severe disease or a severe case that may be positive and have no symptoms or very mild symptoms and are not taking the social distancing seriously or not taking serious precautions, thinking that they may be immune to it. And those people are potentially spreading it wider because they're not taking the recommendations seriously.
Well, how about some questions from the viewers? This one comes to us from Sharon Dawn West Williams. Will you become immune to it if you catch it and get better?
So this is something we don't quite know yet. With these viruses, it's possible that it can change or there can be different strains of it. As we see with the flu, there are different strains of the flu. So theoretically, you can get it, and then as it changes over time, there'll be a new strain of it which you won't be immune to, so you can continue to get it. So we want people to take this seriously, and even if they've been exposed and they've recovered, to still maintain their distance and follow all the precautions.
From Catherine Shattuck, how long does the virus live on various surfaces, and how long does it hang in the air from breath, coughs, or sneezes?
So that depends on a lot of factors. If you're inside, how the air is circulating where you are, and there's a difference between airborne transmission and respiratory droplets. So airborne transmission, like a disease like the measles, just hangs in the air for a very long time. This is a respiratory droplet transmission, and so we think that it's going to hang in the air for a shorter amount of time. Some people have speculated up to 3 hours. That seems like a long time to me. It's probably more on the order of minutes. And then what happens is as someone coughs or sneezes, and those droplets and those secretions land on either the person's hand or on a surface, and then you touch that surface within a short time frame of it landing there, and then you touch your face, that's how you can get it. We just don't have a lot of good information on how long exactly, what kind of surface. Is it like a steel surface? Is it a porous surface that can absorb it? So I don't have a great answer for that in specifics. So that's why we're asking everyone to just be super careful about hand washing and cleaning off your phones too. That's the big thing.
From Patrick Areno, could I already have it and not known it? And like a common cold, could I have already be afflicted with coronavirus and not know it?
Yes, definitely. And that's what we were talking about earlier, particularly in younger, healthier people who may not have severe cases. They can definitely have it. It can look very similar to a cold or flu, and you may have even already recovered from it, or be having it right now. And if you're not actively following these public health measures, then you could be spreading it.
All right, Dr. Nanos, thank you so much for the information. Certainly appreciate your expertise and your time this morning. We're going to take a quick